For those of you who just joined, I'm Nancy Burke. I'm in California, one of the editors of the book. An important theme that we picked up in our book and really explored in depth is the ways in which COVID-19 exposed inequality, structural violence, xenophobia, and racism, especially. As we all know, Black Lives Matter had reverberations globally, and we're interested in talking about this in a little bit more detail. So starting with you, Sarah Gibbon in London, what happened in the UK that illustrated racism's global reach?
Thank you very much, Nancy. I'm just going to share my screen. Hopefully that's going to work. Tell me if that's the case. So I'm really delighted to be part of this event. With my co-authors, Jenny Gamlin and Melania, to contributed to this hugely important volume, and even more so that this is part of UCL Press Embodied Inequalities book series that Jenny and I co-edit. As series editors, we've really witnessed firsthand the incredible dedication, determination, and huge amount of work I and Nancy and Lenore have undertaken to bring this volume into being. So the collective motivation for writing this article came from a growing sense of dismay and anger about the gaping chasm between the public message from the UK government at the start of the pandemic that the virus doesn't discriminate, and the unfolding reality in the spring of 2020, which saw death rates in the UK among the highest globally. This initially emerged in the UK through social national media and local hospital accounting, revealing stratified exposure, vulnerability and death from COVID-19. And in June 2020, Public Health England confirmed that Black, Asian, minority ethnic communities in the UK were twice as likely to die after developing COVID as white communities. So in this context, racism's global reach was brought to the fore in a number of different ways, and I just want to illustrate that. So firstly, in the colonial patterning of care provision in the UK, the Britain's National Health Service, the centrepiece of the UK's epidemic response, was created and is sustained by a combined labour of EU and colonial diaspora communities. The specific patterning of care we suggest in our article is an afterlife of colonialism, where the same second and third generation of families invited to the UK in the days of dwindling colonial power are also caring for the ill and dying. And here we point to how the idea of heroism with rainbow flags put up in windows, the national clap for carers every week to thank NHS workers, contrasted with the institutional and government failures to protect those individuals most exposed and vulnerable to COVID. Secondly, the material politics of the pandemic. The political moment in which COVID emerged coincided with a departure from the EU, the so-called Brexit in January 2020, which largely rested on an assumption of political superiority and British exceptionalism. And as we outline in our article, this isolationism had consequences in the failure to adequately source sufficient personal protective equipment, leaving key healthcare and frontline workers without this vital material defence from COVID-19. And thirdly, the naturalisation of bodily difference and the category of BAME. So the acronym BAME, Black, Asian, Minority, Ethnic, which has become the accepted label to define and sort many different ethnic groups by their shared characteristics of not being white European descent, also became widely used during COVID-19. But we suggest in our article, this also had the effect of implying that innate biological, genetic and essentialized cultural factors were at play, obscuring social causality and pointing again to the coloniality of political dynamics. And then finally, the failure to acknowledge structural racism as a risk factor. So while confirming health differentials in rates of exposure and death from COVID-19, UK health and government institutions have consistently failed to foreground racism as a risk factor, even at the moment when the brutal murder of George Floyd and the global Black Lives Matter movement was opening up this dialogue. It's chosen instead to highlight structural inequalities as risk factors, such as occupation and housing, rather than acknowledge and address how, to quote Baroness Doreen Lawrence, COVID has thrived on decades of racial discrimination. I'll stop there. I hope those brief points have drawn from our discussion of our article to just highlight a little bit how what happened in the UK really does powerfully illuminate racism's global reach.
Wonderful. Thank you so much, Sarah. So Adi, in Geneva, you write of the shroud stealers, and you're not talking metaphorically, I think. Can you talk more about this, please? You're on mute. Adi, you're on mute. You're still muted.
Okay.
There you go.
No, I thought I was just automatically muted, so I assumed. Can you hear me now? Right, good. Well, thank you very much, Nancy. This is a huge honor to be part of this amazing collection. And indeed, thank you to my editors, as I like to describe you three, for such an amazing job. And this book is truly special. So yes, in my chapter, I'm not writing metaphorically, albeit, it is a conversation with various kinds of fictions. Even though I do not unpack it in so many words, there is history as fiction competing with actual fiction and storytelling, and then the fiction of public health and global health and some notion which goes into fictionalizing effective response to the emerging pandemic. But more importantly, I think very briefly to sort of go back to your question, I think the way to frame this is to say quite simply that essentially in this chapter, I wanted to jolt myself out of a space of complacency and turn the searing critical gaze inwards, which we anthropologists, normally externalize and reserve for diagnosing, structural violence and chronic inequalities. So the metaphor really forces me to ask to what extent I'm complicit. And this really disturbs me. And at one level, I'm getting on with my life, but there is a certain spectral haunting. And this question comes back repeatedly in classroom teaching, and the next writing project is getting influenced and shaped by this question. So from literal acts of stealing shrouds, and I detail examples in the chapter, to literary, I would say, metaphoric postulates together with acts of stealing or at least denying someone a shroud. By putting these examples forward, I try to force myself into accepting my silent spectating as the price I must helplessly pay. But this makes me no less culpable. And that's the real thinking behind this chapter. And at least the figure of the actual literal shroud stealer is somewhat understandable. So the act of stealing is forced on them. Stealing shrouds becomes a survival technique almost. And so the pauper body is forced to live off scavenging shrouds in some sense. And already we've seen amazing examples appear in the second wave of COVID infection, where a gang of 7 were busted in a North Indian town. They were going from one cremation ground to the next, stealing literally shrouds of the dead waiting to be cremated. So, so at least the pauper body is forced to live off scavenging shrouds is understandable, but what's my excuse? I ask myself. It's neither lack of material comforts, nor power, nor a voice. So if this chapter, in a sense, has a voice, then it can only be in the register of anguish, outrage, and seething anger, turn inwards and outwards. And this chapter doesn't offer, at least I don't see it that way, it doesn't offer a glimpse into what actually happened. I don't think we can ever write about what actually happened. So it doesn't really offer you a glimpse into what actually happened, but it's a reflexive conversation. It's at least a start of a reflexive conversation with my craft and my vocation. And it's a conversation which is going to be long-winded, I'm afraid, because there are no straightforward answers emerging. And I feel that something more practice-oriented and practical and tangible needs to emerge from the kind of work we do, and do rather well, I dare say. But where do we go from here is primarily the question I'm asking in this chapter. I don't know if this answers your elegant question, but I mean, it's a little snapshot of where my thinking is at and how stressed I am about this whole issue.
Well, thank you. Really provocative comments that I think we're going to spend some time discussing in the Q&A. So Cristina Pop in the US and writing of Romania, and Oğuz Alyanak in Germany and writing of Turkey, you both deal with exclusion and reaction within this overall theme. So Oğuz, I'll start with you first. Can you tell us what happened in Turkey with lockdown and what tensions it revealed?
Sure, thanks a lot, Nancy. And thank you, Lenore, and all the editors for inviting me to participate in this volume. This is an amazing opportunity. So I was in Germany, I was in Göttingen back then, and I've been following what's happening in Turkey about COVID. Obviously, my family's there. I want to make sure that everyone is fine. And for those of you who follow Turkish politics, we know that a lot of things actually makes no sense. As an outsider, but also as an insider, a lot of times you just end up facing a lot of nonsense and you are just surprised how this can just pass. That wasn't the case early on with COVID in Turkey. Actually, things made quite a lot of sense. There was a new Ministry of Health that was in charge, that was on television. There was a scientific advisory committee that was making decisions. You weren't seeing the president, the Erdogan face on screen all the time. It was a scientific conversation that was about precautions, things to do, things not to do, etc. This was back in February of 2020. And then in March, two things happened. First, the pilgrims that were coming back from Mecca, they weren't quarantined. And back then, Saudi Arabia and the Arabian Peninsula was one of the hot zones. That was the first failure. And second, a lot of public spaces were closed quite late, including the mosques. With these came a lot of criticism of the governments. And this criticism had to do with how can you jeopardize our lives for the sake of a religious ideal. That was basically what the bigger conversation was about. So first, there was this big conversation about religion versus science that makes sense in pretty much all contexts around the world, but also is particular to Turkey in this sense, because there is then that second layer of political Islam versus secularism, a big conversation that's been going on in Turkey since its foundation, but has been quite heated and very polarized for the last 15 to 20 years. And then there was this conversation about what's happening? Is this a punishment by God? Is this what neoliberalism does to people? Is that sort of like what we get to pay for as a cost for the kinds of times that we live in? So there were these big debates. None of these debates have clear answers from any side. I mean, even as anthropologists, these are things that we keep on discussing. And as politicians as well, they had no clear answers to these. But these criticisms kept on growing to the extent that on a daily basis, all that you were seeing was the failures by the government to respond to COVID and the way it's spreading in Turkey. The numbers increasing exponentially starting April. And that's what you were seeing all the time. So the whole conversation turned into one where government was being critiqued. And that's something that's quite rare to see in Turkey these days. And COVID was doing that. So for a lot of critics in Turkey, this was a moment for taking down AK Party. Like that's our moment. Let's just like build on this. And then what happened was quite interesting because everyone thought that this was quite a like well-built argument with strong criticism and with the government not being able to respond properly. And all of a sudden, the Director of Religious Affairs, Diyanet, came up and said, the president in his address said that this has to do with people that are living non-heteronormative lifestyles and gays. Out of nowhere, no sense. It just doesn't make any sense. It has no scientific basis for it, but of course, like that's not the aim. So I was interested in looking at what this kind of shift in rhetoric, shift in discourse does in the COVID moment for a country like Turkey that's been dealing with polarized politics for quite some time. For me, what it did was to change the whole conversation, shifted from blaming the government into blaming a group of people. Mm-hmm. In this case, homosexuals in Turkey, gays in Turkey, as the members of the LGBTQI plus community, as well as those that are single, that are not conforming to that heteronormative lifestyle in the government's worldview. And that's exactly what this change, even if it made no sense, was doing. So something Great. That makes no sense was making a lot of sense from my perspective.
Thank you so much. Cristina, you suggest that the Roma in Romania were already used to everyday acts of violence and exclusion and drew on these experiences. Can you tell us more?
Yeah, sure. So Romania has the largest Roma minority in Europe, and the pandemic has really intensified racist and xenophobic attitudes against the Roma. So what happened in early April 2020, a town of 12,000 in southern Romania was completely surrounded by the military and locked down completely. And the town has a significant minority of about 30% Roma population. And the lockdown came after 37 cases and 7 deaths were recorded, all traced back to a Roma funeral. And to the despair of the Roma did not take the lockdown seriously, live streaming huge parties on TikTok, among other things. While the COVID-19 crisis raised unprecedented challenges for many around the globe, to the Romanian Roma, the pandemic may just be the latest in a series of instances in which they were shamed for their transnational mobility and subjected to containment. And I reviewed 2 such precedents. One is the swine flu, the H1N1 pandemic of 2009-2010. And then the other one is the measles epidemic in Europe in 2016-2018. So what happened is that during the swine flu pandemic, all hospitals were quarantined so they closed access to everybody, the general population in Romania. But in Romanian public hospitals, especially in maternity hospitals, it's current practice to actually segregate Roma patients at all times. And similar practices have been actually documented in Bulgaria and Hungary, where parturient Roma women are placed together in so-called gypsy rooms, which are usually placed near the hospital entryway. So ironically, during the swine flu pandemic, this confinement within confinement created a breaching opportunity for the Roma family members, because since the practice of segregating Roma patients was already part of the racist setting of the hospital space, the family members of the Roma women were actually prepared to penetrate the spatial boundaries and successfully did so by using informal payments. So the Roma disregarded the interdiction to enter the quarantine hospital and worked their way around it. And of course, this bribery only worked with the complicity of the non-Roma medical staff, who rewarded transgressive behaviors by granted access to the quarantine hospital, only to later denounce such behaviors as expressions of Roma's inclination toward illicit action. So what I'm saying is that overcoming barriers to hospital access during the swine flu pandemic provides one example of what may have prepared the grounds for the Roma to not take the COVID-19 quarantine seriously. And then a second example comes during the 2016-2018 measles epidemic in Europe, epidemic in Europe, where the Romanian Roma were alleged to have brought the disease from Italy. And this despite the fact that there are about 1 million non-Roma Romanians who commute between Romania and Italy. So overall, the 2016-2018 measles epidemic exposed the existence of entire Roma populations who were omitted from mainstream healthcare because of structural barriers such as poverty, racism, and discrimination. But what was more interesting was that the epidemic highlighted all these stereotypical narratives in official public health discourses that shame the Roma for their transnational mobility, the whole wandering gypsy stereotype.
Okay, thank you so much.
Okay,
We're out of time, but thank you. That was wonderful. So I'm going to hand things over to Judith, who's going to bring questions in from the chat. And of course, among the panelists, if you have questions for each other too, I'll hand things over to Judith now. Thank you.
Thank you, Nancy. What a wonderful conversation. Obviously, everybody is pointing out to how the pandemic brought up or exacerbated the perception of inequality, the reality and the perceptions of structural inequalities. But what I would like to get us thinking is what comes through the questions, some of which came up in the previous portion regarding the politicization of the public health issue. And I want to quote some of the questions that came in that has to do with the politicization. For example, questions about the stigma and blame. Ali Taki Shah from Pakistan asked what role did anthropologists and social scientists play on countering the phobia against obesity in Mexico. And then later on, he also asks more of the same. Andres Schumann from Yucatan asks how the lack of testing and lack of adequate reporting of cases shows actually the politicization of health. Edna Bozar from Kenya shows how from ethno-violence in Kenya, the pandemic brought a sense of calmness. Whitney Marguerite is asked how, in a similar situation in the future, how can anthropologists assist in getting more adequate information? I think all these questions bring up, and I hope to have more questions, to the fact that public health issue is politicized and increases the current polarization within almost any country in the world. Thank you. Thank you, Nancy.
Wonderful. So do we have any other questions before we move on to the next?
There is a question from Josue Villegas who's responding to Oğuz and says it's interesting in Yucatan, Mexico, the local government blamed young populations for the third wave. He said that because they go out for fun, they don't wear face masks properly, get drunk, and contribute to the increase of numbers in COVID infections. And there is another question from Bashir Akhtar, public health researcher from Bangladesh, who says that similar to Turkey, their research found a similar perception among people that Muslims will not be affected by COVID. And he asks, was there any involvement of religious groups or leaders in supporting the government?
Perhaps just to quickly respond to that, since there's a question addressed to me. Of course, there were a lot of religious authorities did wage and a lot of what you would call in the US the televangelists in Turkey, in the Turkish context, did wage in, because this was, in a sense, their moment to shine, and their moment to also show their support for the governments. So they did all wage in, and they did back up. There were even like on social media hashtags. I talk about all of this in the chapter, so I don't want to get into detail here. Hashtags for support of the Directorate of Religious Affairs and of the Turkish government, the AK Party governments. But just to add, there's also another question by Ali. And of course not, it's not just that people that were coming from Saudi Arabia were, it was just one case in which we could see the government's lack of efficiency in responding to the moments, to what the moment brings. So that was just one of the instances. It's not the reason why COVID became a thing in Turkey, of course.
If I may also follow up on Oğuz's presentation, he also shows how the public issue is politicized when he says that in Turkey, and I think that's the case globally, the public face talking to the general public about how to protect oneself about COVID were the scientists. And then that public face was replaced by governments. And I may add that it was not only a homogeneous government, but it was different factions within a government.